Can you drop 14 pounds in one day by deworming parasites for rapid fat loss? Yes, and I will explain how. So when Heidi Klum shared her love for parasite deworming, she got a lot of flack for it, but she's actually right about that because it is recommended to do a yearly parasite cleanse, even if you live in a developed country, and I'll explain why shortly. My firsthand experience seeing how somebody can drop 14 pounds in one day, literally overnight, via removing a parasite, it was Tanya in this specific example, that happened a long, long time ago before I got into functional medicine and before I understood the importance of gut health and all that kind of stuff. And that immediate family member had a stool test done, showed that they have tania. And so they took the anti parasitic drug. Now, the caveat is that they took it all in one day. You're not supposed to do that. And that is why the tinea died off and it was eliminated via the stools and you could see it in the stool, all of it. And that led to a 14-pound drop overnight. Do not try this at home. It's better to do a gentler approach and take a few weeks to eliminate the parasites from your body, and you'll still get the same results. Because if you do this in one shot, then there is a chance that you might suffer some toxic effects from the drugs because they can be a little bit hard on the body. But this just goes to showcase how powerful your gut health is in influencing your body weight. And this might be why it's very difficult for you to eliminate some pounds. Maybe you keep trying and you feel like you have some weight loss resistance, and that could be the reasoning why. So in this specific case, the family member had Taenia solium, which is the pork tapeworm, but it actually is found in a lot of foods you're probably consuming, and I'll explain. Taenia solium is the cause of actually 30% of epilepsy cases in many endemic areas where people and roaming pigs live in close proximity. And in high risk communities, it can be associated with as many as 70% of epilepsy cases as well. Now, are you being exposed to Taenia without your knowledge? Are you having a lot of steak tartare or any kind of raw meat, undercooked pork? Actually, all raw meats carry the risk of exposing you to titanium. And there are additional foods that I will explain later in this presentation that could all carry tania in them. And sometimes you might carry the infection and not know you have it. You might have mild symptoms like constipation that just doesn't go away, or you just might not have any symptoms, at least in the short term, but things could get worse if you're not on top of it. Hi, I'm Dr. Sarah Zaldivar. I have a PhD in nutrition and exercise physiology from the University of Miami. I was featured on the first ever carnivore diet TV show called Reverse TV series. Don't worry, you don't have to be just carnivore in order to do the deworming, but it is a helpful healing diet that you might consider at least for a few weeks. I also have taught for over a decade at the University of Miami, Miami-Dade College, the American College of Sports Medicine, and elsewhere before I quit to focus on coaching people online and researching and publishing content online. And I've coached thousands of clients. You can check out the testimonials on my website, drsarahzaldivar.com. And I've lost 35 pounds and I've maintained it for years now by raising my baseline dopamine level. But this is not about dopamine. I have other content on that. Let's go back to the parasite deworming for fast weight loss. So parasites, what are they? They're organisms that live in or on a host and they feed off of the host. So in the case of parasites that we're going to consider in humans, we usually ingest them and they inhabit our gastrointestinal tract. So they are in our guts and they derive nutrition from us and they also harm the host. This is why they're called a parasite, not a symbiotic relationship whereby symbiosis is both the human and the bacteria are benefiting, like in the case of probiotics. A parasite is not a good thing because it's creating inflammation and health issues for the host or the human. Most people think that parasitic infections are more common in areas with poor sanitation. And while that might be true, we actually do find them everywhere. It doesn't have to be in an area of the world where you don't have a lot of technology or sanitation or medical care. What are some additional food sources of parasites? Are you eating undercooked or raw meats and seafood? Raw fruits and vegetables, specifically those that are grown in contaminated soil? Unpasteurized milk. A lot of my audience might be carnivore, and so they might be eating lots of steak tartare, raw meats, and unpasteurized milk. So you really, really want to be careful with those kinds of practices. And also, there's a push now towards consuming insect protein, that's a whole other headache by itself because they have even more parasites. And so we don't really know just how safe that's going to be if that whole trend takes off. Now, while you're following a parasite cleanse, it is important to wash and cook your foods really well and avoid common dietary sources of parasites to avoid reinfection. So you don't want to go through the detox and the deworming phase and then go back and have steak tartare, right? What are the symptoms of a parasitic infection? Digestive issues like diarrhea or constipation. Most of the time, the clients that I see have some form of digestive issue, whether it's constipation or diarrhea. And sometimes the constipation, we do everything, and it would have been better if we just did a parasite test and done the deworming phase, because that's a common thing that is at the root cause of constipation. Also, unexplained weight loss, but also resistant weight gain. So we really don't know, are you underweight or can you not lose weight because of a parasitic infection? So just changes, unhealthy changes in your body weight could be due to a parasitic infection. Skin irritations, any kind of skin issue, nausea and vomiting, gas, abdominal pain, rectal itching, visible worms, blood, and mucus in stool. That could happen. Fever, fatigue, muscle, and joint pain. All right, so sometimes parasitic infections could clear on their own, but sometimes they can progress and cause infections. It really depends on your health and your immune system, and it depends on what type of parasite you caught and how much of it you did. So the health of your microbiome determines if you are able to clear parasites on your own. But for example, like the Taenia, the pork tapeworm that I mentioned earlier, that's difficult, very difficult to get rid of just with improving your microbiome health. You actually have to take a drug to get rid of it. Now, you can run a gut health test, the GI Effects Comprehensive Profile 3-day test. This is the gold standard test that checks for the health of your microbiome so that we see, do you have a solid support? Do you have good probiotics? Because if you do a deworming phase, and then you keep getting reinfected, maybe it's just that you have poor immunity that starts with a poor gut health. So you can get that test. The Genova Diagnostics test, which is my favorite, is the gold standard, and you can get it whenever you want. It's linked in the description box below. It'll take you straight to my storefront where you can order it under my name. And it's an at-home test, so it gets delivered to your house. You collect the samples in your house, and then they send you the results. And then after that, if you want, you can schedule a consultation so we can go over what the results mean and how you can optimize your gut health. Now, for the parasite stool test specifically, I always order the gold standard one that's more advanced than the regular parasitology test. And that's from Doctor's Data. I get the comprehensive stool analysis plus parasitology. It's a 3-day. You get 3 days of samples, similar to the test that I just mentioned. This one just tests for parasites. It's not testing for every single bacterial strain in your gut, like the probiotics and the different strains of the bacteria that live in your gut. Now, I normally order this during my consults, but if you want to skip this step, you have a direct link to order it again from my storefront. And same thing, it gets delivered to your house and you collect the stools and you send them off and you get the results online, and then you can choose if you want to see somebody at consultation so that you go over the deworming process. The reason I love this is because it requires PCR DNA technology, so it is not reliant on the luck of the lab technician waiting, looking on the petri dish and hoping to see some movement, because the parasite might be in a different life cycle and some cycles they're not really moving, and you can only determine that using PCR DNA. So it is far more accurate. It is the gold standard, and that's the only one that I usually work with. There are a lot of drugs that are utilized for quick elimination and deworming of the parasites. The drug choice depends on the length, how long you've had the infection, and how severe it has gotten. Common first-line antiparasitic medications include metronidazole, albendazole, and mebendazole. Now, the diet is also important. Because parasitic infections are associated with poor gut health, cleaning up your diet is very critical along with the deworming drug. So you want to kill off the infection, but then you want to ensure you don't pick up additional infections. You want to support your health. So you want to focus on whole unprocessed foods, preferably a carnivore diet for a few weeks. That's probably the one that's going to drop inflammation the fastest. And you can do that just for a few weeks to clean things up and then proceed to whole foods if you like. Very important, no alcohol, no sugars, no junk food or ultra processed food. If you want to do things on your own, I do have a guide, the 30-day carnivore diet challenge guide, that you can get for free when you sign up to my newsletter at drsarahzaldivar.com/newsletter. Now, what about if you want to look into herbals and natural ways of deworming? It'll take a little bit longer than taking a drug, but it'll be a little bit gentler on your system. So you can incorporate foods like garlic, pumpkin seeds, pomegranates, and papaya, and that can support the natural management protocol. As a matter of fact, this study that you see here in front of you, it's a randomized controlled trial, so it's a very high quality type of study, and it found that a mixture of honey and papaya seeds was associated with clearing the stools of parasites in over 3/4 of subjects. So as you can see here, the stool clearance rate for the various types of parasites encountered was between 71% and 100% following the treatment that they gave them that basically had the papaya in it. And the authors say that the consumption of these dried papaya seeds offers a cheap, natural, harmless, readily available monotherapy, single therapy, and preventative strategy against intestinal parasitosis, especially in tropical communities. So that's a really powerful treatment. Also, functional medicine practitioners or doctors that treat these things from a root-based approach as opposed to just slapping on a drug and not looking at what caused your immune system to cave into this infection. So what do we usually recommend? Wormwood, dosage 500 milligrams 2 to 3 times a day. Black walnut supplement, dose 1 to 2 ml tincture 3 times a day. Allicin, which is the main antibacterial found in garlic, you want to take pills of 450 to 900 milligrams 3 times daily. No, just eating a ton of garlic is not enough because a typical clove of garlic, not the entire bulb, just one clove, contains approximately 2.5 to 4.5 milligrams of allicin. So it's a very, very, very tiny amount compared to what we really need in order to clear a parasitic infection without utilizing drugs. For those who experience die-off symptoms, which is when you're killing off the parasites and as they're dying off, they're releasing their waste products and toxins, and you might feel a little bit worse. Not everybody feels them, but if you do get those die-off symptoms, then the symptoms will usually appear within 24 to 72 hours of starting an antiparasitic protocol, and they will self-resolve within 3 to 7 days. What are some of the symptoms that you might expect if you are prone to getting die-off symptoms? Fatigue, headache, body aches, increased gastrointestinal symptoms, and low-grade fever. Now, what is the timeline that we are looking at to clear the parasites? To address the parasite in all phases of its lifestyle, it is recommended to pulse dose management. What do I mean by that? So basically, this looks like dosing supplements for 2 weeks on and then 2 weeks off, or 1 to 2 weeks off for 3 cycles. A parasite cleanse, therefore, generally requires 1 to 2 months for success. After the cleanse ends, stool parasitology testing should be repeated, obviously, to confirm that the parasite is done and dead. You don't want to spend all this time and energy and effort deworming yourself and not knowing if the mission was accomplished or not. Might as well get all the benefits, lose all the weight, clear your skin, and just feel amazing when you go through this protocol. So again, the comprehensive stool analysis and parasitology 3-day test, this is what I would recommend. That's the gold standard one that uses PCR DNA to test for if you still have parasites, and it is linked below if you want to skip the consultation phase and just go ahead and order it yourself and it gets to your house. Alrighty, now almost everyone has some parasitic infection that usually causes mild symptoms. And so this is really a low-hanging fruit if you really want to lose a lot of weight very quickly without any other intervention. Now, if you do need more personalized support and guidance, then check out my coaching packages on drsarahzaldivar.com/coaching. And for the next 48 hours, you can have 50% off on all of my coaching packages when you use code YouTube at checkout. You may want to look into the premium package, which is a 12-week coaching package, or you may want to check out just a single visit or a couple of visits like in the bundle package. The coupon will work on all of them for the next 48 hours. And if you want to contact us for more information, check out my website on drsarahzaldivar.com/coaching for coaching, drsarahzaldivar.com/group coaching for group coaching, and all my guides are on drsarahzaldivar.com/shop. And of course, you can follow us on Instagram at dr.sarah.zaldivar. Thank you so much for watching, and I will see you in the next one.